In the Danish Biobank Register, you can search through millions of samples when you're looking for precisely the right biological material to include in your health research project. Some of the samples are stored in freezers in the Danish National Biobank that runs the register, but the larger part is stored locally in other biobanks around the country. In the Danish Biobank Register, you can see, for instance, how many samples from patients with a specific diagnosis there are in the biobanks. You can also see whether there are available samples taken before or after the diagnosis. At the same time, you can connect the samples with data from registries such as the National Patient Register.
Thanks to the Danish Biobank Register, the researchers can get the overview of existing available samples in a very relatively short time, in minutes. So they do not have to go from place to place, from biobank to biobank like they did before, spend months to find out if there is enough material in the biobanks. On top of that, the Danish Biobank Register gives a complete overview of sample existing in Denmark in various biobanks, small ones and big ones, some of which the researcher may even not know that exist.
One of the researchers that has searched for samples in the Danish Biobank Register is Peter Bager.
And we were interested in looking at an association between a genetic mutation and cervical cancer. So what we did was that we searched the biobank register and wanted to find out how much whole blood could we find for all those cervical cancer cases that were in the biobank register. And we actually found 1,600 samples, which is quite a lot for a cervical cancer study. And 900 of these samples were actually whole blood in one biobank. Well, previously we would have to go into the clinics, contact the clinics and the hospitals to get this information about the type of samples and the age and the year of diagnosis or the gender of the different persons that the samples were taken from. But now we can really get this information very quickly, and this means that we can actually start to improve the design of the study even before we collect the samples, and that's quite nice and an improvement from previously.
You can find a detailed tutorial on how to search the register on the Danish National Biobank's webpage, nationalbiobank.dk. Not only researchers can gain from searching the register.
The second large group of users of Biobank Register can be biobank staff who would like to have a look and check how their samples, which they collect in their biobank, link to various diseases. The entire process of linking register data, diseases with samples is carried out offline. That means that the Danish Biobank Register system doesn't have access at all to any private and sensitive data, which means that it only provides the aggregated pseudo-anonymized results to the users.
Before you get physical access to the samples, you need to get permission from a health research ethics committee. Once you have that, you can find link to upload of your application to use the samples on the Danish National Biobank's webpage, nationalbiobank.dk.